Hello, what's up, and welcome back to another episode of A Needle in a Haystack, a behind the scenes account of a mucosal melanoma survivor. I'm Chris White, mucosal melanoma survivor, thriver, advocate, inspirational speaker, and self published author of Killing Cancer with Tills. Real quick before we get started, just a little disclosure. I am not a medical expert. I am only an expert on my story and my experience. If you need any advice or medical attention, please seek out your care team. All right, welcome back to episode 17, picking up from episode 16. We had just finished up the ACS walk on April 12th. The following week on April 17th, I was heading back down to Houston to do my CTs and brain MRIs, meet with my specialist, go over the results, and see how things are faring. Previously I had done the radiation, and it was too soon for me to necessarily know all the results from the effects from the radiation, and so I didn't actually have any plans or anything scheduled to meet up with the radiologist to go over anything for this visit. That would be for the next visit in May, but here on episode 17, starting off on April 17th, 2019, and then meeting up with the specialist on April 18th, 2019. Within this meeting, I would meet with both his fellow or main PA and then him. And so let's get rocking, and I'll start reading over my scans. Okay, so first up, we have the CT of the chest, abdomen, pelvis with contrast. Here are the details. Impression. Improvement as shown by reduction in size of liver and pulmonary metastasis and mediastinal adenopathy. Examination of the CT chest, abdomen, and pelvis with contrast was done on April 7, 2019 at 9:45 p.m. So, we would drive down there in that afternoon, and that evening I would do the CT, next morning do the MRI at labs, and then meet with my specialist. All right, continuing on. Indication, restaging. Comparison was to the prior scan done on February 21st, 2019. Here are the findings. First up, chest. There is a porticath with tip at the cavatorial junction. Mediastinal adenopathy is stable or smaller. Right hilar node, series 5, image 58, measures 1.3 centimeters, previously 1.5 centimeters. Left hilar node, series 5, image 62, measures 9 millimeters, previously 1 centimeter. AP window node measures 1.6 centimeters, unchanged. The left internal mammary node has resolved. Pulmonary metastases are smaller. For example, right upper lobe metastasis, series 7, image 53, measures 2 centimeters, previously 2.4 centimeters. Right lower lobe metastasis, series 7, image 93, measures 1.2 centimeters, previously 1.7 centimeters. Fine interstitial shadowing is seen in both upper lobes in series 7, image 25, and image 37. This could be treatment related or inflammatory. Abdomen and pelvis. Liver metastases are smaller. Segment 8 metastasis, series 6, image 184, measures 2.7 centimeters, previously 4.4 centimeters. Perihepatic implant, series 6, image 210, measures 6 millimeters, previously 1.4 centimeters. Right perineal implant measures 5 centimeters, previously 7 centimeters. The kidneys are unremarkable. The gallbladder and biliary tree are unremarkable. The spleen is unremarkable. The adrenals are unremarkable. The pancreas is unremarkable. There is no retroperitoneal adenopathy. There is a 1 centimeter left external iliac node, series 6, image 289. No pelvic masses are seen. Post-surgical changes are seen in the right groin. Degenerative changes only are seen in the skeleton. A lucent lesion in the right scapula is unchanged. No bone metastases are seen. All right, moving on to the brain MRI. Brain MRI with and without contrast was done on April 18th, 2019 at 10:09 a.m. in the morning. Here are the results. Impression, no evidence of intracranial metastasis. The full result, clinical history of metastatic malignant melanoma. The indication again is restaging. This scan is compared to the prior brain MRI done on February 21st, 2019. Findings, no abnormal parenchymal or lepidogenial enhancement is identified to indicate intracranial metastasis. No mass effect, or midline shift is seen. Diffusion weighted images demonstrate no evidence of acute ischemic infarction. Major intracranial flow is intact. The peritoneal sinuses and mastoid air cells are well aerated. No enhancing orbital mass lesion is identified. Once again, I do apologize if I butchered or murdered any of the vernacular, the verbiage here. Like I said, I'm not a trained medical radiologist or an expert. I'm only an expert on my story and my experience. Here.
The CBD, the chemo still?
No, I haven't done chemo in a while. Yeah, I've been doing immunotherapy.
Okay.
Every 3 weeks.
So do you think you got like 4 doses of the chemo?
I only got like 3.
3, okay.
Right?
And when did the last one?
Last chemo was. That's been a while. Because, alright, so I just did. 3 weeks ago, I did a immunotherapy.
And was that the combination or just the single agent?
No, that was a combo. And then 3 weeks before that, I did immunotherapy. So 6 weeks.
So these
It
are
was
your
probably
two
nine
chemos.
9 weeks ago.
So February 4th, 5th, and 6th.
That was the last
chemo.
time I did.
And then he had it again on the 25th, 26th, and 27th of February.
And then I think that was
and then
it.
he had immunotherapy on March 11th.
Okay.
And that was the Epinevo.
Okay.
And then he had immunotherapy again on April 1st, same combo. And then he had radiation on April 4th, 5th, 8, 9, and 10.
And then Monday I'm doing immunotherapy again.
No, the 22nd. Oh, that is
No,
Monday.
yeah, I'm talking about this coming
Hi.
Monday.
2, 4, 22. Okay, and the radiation, where do they radiate?
Well, they did a couple spots in my lungs and my kidney.
And the mass behind his kidney, his right
Okay.
kidney.
Clinical trial.
Hmm.
Special, right?
Yeah. Okay, and symptom-wise, I heard the pain in the back, kind of flank, your side and back.
No, just every once in a while. It's not always. I mean, but just kind of like right here a little bit, you know, like right here, you know. But
It's controlled with your pain regimen that they have you on?
yeah,
And then any headache or vision changes?
no,
Shortness of breath, coughing, wheezing,
no,
chest pain,
a little bit.
any nausea?
No. Every once in a while, you know, but it's really like, you know, I still got all my nausea meds that they prescribed during when I was at chemo, so like if I feel just a little bit, I just take some of those.
Okay.
Like, nah, but I've been able to, you know, keep all the nausea at bay like really well.
Good. And any diarrhea or constipation?
None of that.
Muscle weakness?
No, well, I haven't really tried to lift much, so.
And then fatigue, generalized fatigue?
Yeah,
treatment?
yeah, definitely just fatigue from
All the treatment.
yeah. Well, most of the time the immunotherapy always kind of gives me like energy, you know, like afterwards.
Oh,
like, you know,
that's good.
like I'll come out of there and I'm like for that week, you know what I mean? And then for that first week, like I have a lot of energy, and then by the end of the week, I'm like really dehydrated. In fact, one of the first times I had to come in and get a bag.
Okay.
But most other times it's just I've gotten real good about, you know, not only staying hydrated but staying on top of my electrolytes. And then like I'll have like a weekend where I just go to crash for like, you know, those 12-hour sessions.
Okay.
You know, catching up on rest. But
Gotcha. That's good.
But then, yeah,
Okay.
and then I've only had one time afterwards where it just kind of, I was automatically just fatigued.
Oh, right away.
So,
Yeah.
I don't know. I'll find out again.
Yeah. For your scans, your MRI brain's negative, so that's good.
Sweet.
CT, chest, abdomen, pelvis is improvement. So improvement in reduction in size of liver, lung, and lymph nodes. So everything
Beautiful.
is shrinking. So that's really good. And then lab-wise, you look good. Your thyroid's improving, but still not back to normal. Are you on the 100 micrograms of
It's
the...
actually here, Dad, give me the. Yeah, let me double check. It's point whatever.
I'll see if he wants to go up on it or just give it a little more time. Because you started that in February.
It's been 6 weeks, I think.
Okay.
Maybe no. Yes.
Yeah.
My bag of goodies. My bag of goodies. Here it is.
Okay, so I'll ask him if he wants to go up on it.
Yeah.
Or say,
I just renewed this prescription, so keep me posted.
yeah, so this is y'all's copy of the scans.
Great. Thank you.
Oh, cool.
Did the kidney one go down at all?
The kidney, at least if they mention it. I don't think they...
That was the whole
They
point of my
didn't mention it by then.
radiation.
I wonder if it went to the point where it was hard to see.
Like the next scan will show it a lot better. You know, that was the whole point of my
I
radiation.
think our
on
next
it.
one is a PET anyway.
The PET scan, yeah.
But him by radiating those spots and then the
Mhm.
immunotherapy attack
Kind of that
afterwards.
combination, yeah.
So I'm
yeah,
sure
they
like
didn't even mention the kidney, so I wonder if it shrunk.
I'm
Oh
sure
wait, here, hold on. Yes, it did. Right perirenal implant shrunk. So it went from 7 centimeters to 5. So it's shrinking.
badass.
That's great.
That's good, man.
Very good.
Cool.
Okay, let me take a listen to you and then we'll get him in here.
Sure.
See you.
Do I need to take off my sweater?
I can hear it.
Okay.
Deep breaths. Okay, bring the normal.
Alright.
Sounds good. Lift your head. Say ah. Feel your lymph nodes. Any swelling in your neck or armpits?
No, I just gained some weight, but that's okay. I don't, nothing that's, like, my right leg, I had the surgery,
Mhm.
and everything, like, I don't know if once again it's related to my weight gain, but, like, it, like, really kind of, just the numbness or whatever. I don't know, it just drives me nuts. I mean, I'm trying to, it almost feels like sometimes I gotta, like, lift it, or whatnot. I'm trying to figure out if my, my physical therapy script is still good.
Oh yeah. Well, let us know
Whatnot.
if you need another
That's
one.
I'm
Maybe
not
just
sure if my
print
old
one
one
out.
still works, so I was
Okay.
gonna check. And
Yeah.
if not, just get a new one, but I'm gonna work with them about
Yeah.
not being so dumb.
Nerves
trying
take
get some good
forever to
stuff.
regrow, but they do eventually kind of
Yeah.
start to get sensation
Okay.
back. But it's good to work with the physical
Okay.
therapist too. Okay, let me
Cool.
go get Dr. here.
All right.
Before you grab the doctor,
Yeah.
can he get his teeth cleaned?
Yeah, am I
During
allowed to see the
treatment
dentist?
now, since he's not doing chemo right now?
Yeah.
Okay.
Yeah, your
Okay.
labs looked good, so you don't have to. We worry about whenever your white count drops, but yours
Right.
looks good. So.
Okay.
Yep.
Thank
Cool.
you.
And
Thank
if
you.
they need to give you like antibiotics, that's okay to give with the immunotherapy.
Okay.
Yeah.
They don't normally give us. Oh, doc.
How we doing?
Doing good, man. How about you?
Alright, so Teresa told you the good news?
Yeah.
Of course she does.
This is
When there's the
shrinkage.
good news, she spoke me up.
Yeah.
Alright. So, everything is shrinking. So this is what we wanted to halt,
Yeah.
We wanted to halt it with chemo, then continue with immunotherapy. Jim blasted that one.
Yeah. Yeah. He
Okay.
said I think next time
6 weeks from now when I come back, he wants to see, come visit,
Yeah.
see how it worked. He said, you know what I mean, and everything.
Because it's for him, it's too early to see.
Yeah,
the
exactly.
Yeah, no. So we are achieving what we wanted to achieve. So this is very good.
Yeah.
So we're gonna continue with immunotherapy. You're getting another dose in 2 to 3
Monday.
days. Yes, excellent. And this will be your 4th dose, but I'm gonna call her and see if she can give 4 consecutive doses because the
Okay.
first one was separated from the.
Sure.
I'll see. I mean, the insurance may quote her because.
But every 3 weeks continues, right?
So no, we cannot continue that.
Oh, no?
We have to. Well, the year is giving only for 4 doses.
Oh, okay.
So, but we're gonna try to give. So Monday you're getting your number 4.
Yeah.
Yeah. So we're gonna say that it is number 3. Try to see
Yeah.
if she can give us one more.
Okay.
And then you'll switch to Opdivo alone.
Okay.
Okay, that's the regimen. That's how
Yeah.
it's approved. Now down the road, we'll see how is it. I may recircle and do. The insurance will never allow us within 3 to 6 months
Right.
to do that. But we have the tricks to do it after 3 months. We'll see if we can get away with it or not.
Okay.
Just not to give it a chance to breathe. We don't want it
Yeah.
to breathe. Okay.
Let's choke it out.
Yeah, so we'll continue with that and see. But right now we are in good shape. How are you feeling? Now this is
Pretty
the
good.
scans.
Pretty good. I mean, you know, a little tired. You know what I'm saying?
Your thyroid is
overall,
recovering, but it's
yeah.
still not full. So you know.
You know, I mean, overall, I mean, like, you know, pretty tired for the most part. You know, other than that, I mean, feeling pretty good, I guess, considering all things.
Yeah, well, no, we want to improve, you know.
Yeah.
So, but you're gonna give yourself with the thyroid because the thyroid is not there. you
Yeah.
know, and the thyroid is an energy.
That makes
gland,
sense, you know,
so
sense,
it's
yeah.
still, and it was 0, so on the numbers is not the energy as well. The
Yeah.
numbers goes up. It takes time until you fill the tissues with these thyroids.
Well, one of the things I was noticing, all my other immunotherapy treatments, I get a lot of energy afterwards for like a week. But the last one that I had, like 3 weeks ago, like, I didn't get all the energy right afterwards. You know, like, I was kind of tired.
Yeah, well, it accumulates. You have to
Yeah,
understand.
yeah, that's
You've
what I
been through
thought.
a lot, and don't forget the stress you've been through.
Yeah.
You were afraid, you were stressed, you were, you know, surrounded by people around you who cares about you and afraid, so that takes a toll.
Yeah.
And it will catch up with you when you are in adrenaline and you want to fight and fear, you don't feel it, but it will
Right.
catch up. But it will go away. If we continue with that and hopefully we achieve what we achieve, these things will recover some.
Yeah,
Okay, so we'll
for
be
sure.
happy with that. But I don't want to increase the thyroid doses right now because it's
Okay.
recovered. Since we're gonna see you soon, so we'll,
Yeah.
we'll see what it is. So you get 1 dose on Monday. So and I'll have to see if the gym schedule gets scanned, and perhaps we'll repeat it again in 6 weeks and see what we're doing before we start the Opdivo alone.
Okay.
Alright.
So
So don't
Monday I do my 4th, you know, combo, but then 3 weeks after that,
I
maybe
wanna-
just do the Opdivo alone.
I know. So that's what I'm saying.
Yeah.
The 3 weeks
If
from
we
that,
can-
I want to do another combo.
Oh, okay.
So I want to consider your
Yeah.
4th number 3 because
Okay.
I want to do 4th consecutive.
Gotcha.
We may not be able to do it. It's an insurance
hear what you're
issue,
saying now.
because these drugs
Yeah.
are crazy expensive.
Yeah.
So we'll see if we can get away. If we don't get away with it, that's fine.
Okay.
That is fine. I remind you again with the side effects. You have diarrhea, you call 2 days
Yeah.
before it happens. You have a dry cough or shortness of breath, you call 2 days before it happens. Everything else I'm monitoring, it seems to be okay. One thing is I want to let you know that it is your kidney took a hit. That's probably from the cisplatin from the chemotherapy, but it's stable. Has not
Yeah.
got worse from last time.
Okay.
So, and hopefully it will recover.
Yeah.
Some. All right. Hydrate yourself. Keep
Lots of
hydrating yourself,
hydration. Yeah.
Listen to your body right now. It's okay to get relaxed and get tired. You've been through the middle of the eye of the storm, so
Right.
it's okay. That doesn't mean that's the rest of your life like that is gonna be.
Yeah.
Okay.
No, I got you.
You've just been into so much stressful events.
Okay.
All right.
Cool.
With the radiation and all what we did, this is a lot.
Yeah.
No,
I
it's a
got
lot.
you.
It's not. Yeah, it's a lot. You put it on a mountain, it will melt.
Yeah.
You've been through so much chemo, so much immunotherapy, so much stress, and then I asked the gym to blast that
Yeah.
You know,
He
the
did.
surgery said that it's gonna be complicated and everything, and
Mm-hmm.
St. Jim blasted.
Yeah,
Yeah.
well, they did.
He's the
Yeah.
best guy.
They did
He's
hard.
the best guy to it. If I had what you
He's
had,
pretty
I'll go
good.
to Jim. Okay, and he's very pleasant. as
Yeah.
well. Yeah. All right, man.
Cool.
So you call me. I have
Yeah.
a motion now. We focus on the side effects.
Thank
Okay.
you.
Thank you.
Thanks, Doc.
All right. Take care.
Yeah.
Bye bye.
So we'll see you again in 6 weeks.
Yeah,
For more
yeah,
scans.
yeah,
Does he
yeah.
get a PET scan the next time?
I
Or-
think just
6
stick with the
months.
scans, just monitor with that. There's no need for a PET right
Okay,
now.
just
PET does
regular
not
CT.
detect more. The
Yeah.
CAT scan is more accurate for the sizes.
Gotcha.
Okay.
There's
Okay.
something in the leg or something that
Mhm.
outside the chest abdomen pelvis we can get it. But at the moment we're fine. Everything is here is shrinking. Some of them actually here I barely can see, so there's
That's
something
great.
shrinking.
Okay.
Fantastic.
All right, we'll
Good.
continue
All right.
what we're doing. Okay.
Yep.
Cool.
Thanks.
Thank
Take care.
you.
Thank you very much.